Good morning, class. Welcome to today's online anatomy lecture. I am Dr. Taskina Ahmed Chowdhury. Hello, class. Are you listening?
Yes, ma'am.
Fine. So, I am Dr. Taskina Ahmed Chowdhury, lecturer, Department of Anatomy. My today's topic is anatomy.
This conference will now be recorded.
So, what is the extension of arm? What do you mean by arm? Arm is the part of our body, it's the peripheral part which extends from shoulder joint to tip of the fingers. Also including the breast in case of females and the scapular region. So, this is the upper limb from here to here, including the breast and posteriorly the scapular region. So what are the contents of this part of the body? It contains, first it is covered by skin, then superficial fascia, deep fascia, then some muscles, and the deeper structure there are the bones of the extremities, and also there are vessels and nerves supply all these structures. So each of the upper limb has got several bones and multiple joints. What are the joints of the bones of the upper limb? There is the clavicle, the scapula, the humerus, which is the bone of the arm. There is the ulna and radius, the forearm bones. Ulna lies medially and the radius laterally. And in the hand, there are small bones of the hand, proximal to distally. First, there are the carpal bones, 18 numbered. Medial to laterally, we name them as in the proximal row and distal row. Proximal row contains scaphoid, lunate, tricochlear, and pisiform. And distally, from medial to laterally again, there are trapezium, trapezoid, capitate, and hamate. Then, just distal to the carpal bones, there are 5 metacarpal bones, numbered from lateral to medially, first, second, third, fourth, and fifth. Then lying distal to this lie the phalanges in the fingers. 2 for the thumb and 3 for rest of the fingers. Named as proximal, middle, and distal phalanges. What are the joints of the upper extremity? There is the shoulder joint, which also articulates with the clavicle and scapula. The humerus articulates with the clavicle and scapula also. And distally, the humerus articulates with radius and ulna together, forming the elbow joint. Then there is the wrist joint, and finally, small joints of the hand. These are the bones of the upper limb. What are the parts of upper limb? Parts of the upper limb include the arm, extending from the shoulder joint to the elbow joint. Then there is the forearm, from elbow joint to the wrist joint, and from the wrist joint onwards to the tip of the fingers, it's the hand. And also there is another part called the shoulder, which is the proximal part of the limb, overlapping part of the trunk, that is in front overlaps the chest, posteriorly overlaps the scapular region. These are all parts of the upper limb. Today we shall be studying the arm, more specifically back of the arm. The arm is divided into 2 muscular compartments. One is the anterior compartment, the other is the posterior compartment, divided by 2 muscular septum. One is the medial neuromuscular septum of the arm, another is the lateral septum. This is the anterior compartment and this is the posterior compartment. Both of these compartments contains some muscles, vessels and nerves supplying them. And the deepest structure lying deep to all these things, there is the humerus at the center, which provides attachment to these muscles. So what are the contents of posterior part of the arm? The muscle of the posterior compartment is triceps. It's a single muscle with 3 bellies of origin. And there are vessels, that is arteries, veins, and there are nerves. The artery of the posterior compartment of the arm is the profunda brachii artery, and the nerve of the posterior compartment is radial nerve. Now the muscle, triceps brachii. Why is this called triceps? Tri means 3. Triceps means this muscle arises from 3 heads of origin: the long head, the lateral head, and the medial head. So where are these heads? And where is my cursor? This is the long head of triceps, takes origin here from the scapula, specifically infraglenoid tubercle. Here is the glenoid cavity of scapula, which forms part of the shoulder joint. And just below this, there is a tubercle called the infraglenoid tubercle, which provides origin to the long head of triceps muscle. Then there is the lateral head. This one here, lying laterally, it is the lateral head. Takes origin from the posterior surface, upper part of the posterior surface of shaft of the humerus, above the radial groove. And then the medial head lying deep to this is the medial head. এই যে নিচে দেখা যাচ্ছে উপরে দুটোর মাঝখানে, this is the medial head, arises also from the posterior surface of the humerus, upper part, just below the radial groove. These 3 are the 3 heads of origin of triceps brachii muscle. Now, where are these heads inserted? All of these are together inserted into the posterior surface, posterior part of the olecranon process of ulna. What is the function of triceps muscle? Triceps acts as an extensor of forearm at the elbow joint. These are the 3 heads: long head, lateral head, and the medial head lies deep, so it is not seen here. Now, the radial nerve. This is the nerve supply to the muscles of both posterior compartment of arm and the forearm. It arises from the posterior cord of the brachial plexus. Brachial plexus is a large plexus of nerves formed from branches of the lower cervical and upper thoracic segments. So the radial nerve is the largest nerve of the posterior cord, largest branch of the posterior cord. It has got a root value extending from 5th to 8th cervical and also including the 1st thoracic segment. What is the course of the radial nerve? In the arm, it gives branches to the triceps muscle and passes in the spiral groove. Here, on the posterior surface in the spiral groove. Then, this is the radial nerve. Here it is accompanied by the profunda brachii vessels. Just above the elbow, it passes the lateral intramuscular septum and comes from the posterior compartment to the anterior compartment, then continuing downwards into the cubital fossa. What is the cubital fossa? It is a space lies just in front of the elbow joint. Here. This is the location of cubital fossa. At the level of the lateral epicondyle of the humerus, that is about here, it divides into superficial and deep branches. The superficial branch is the content of the cubital fossa, and the deep branch passes posteriorly and provides nerve supply to the muscles of posterior compartment of the forearm. So we can say that radial nerve is the sole nerve supply to the muscles of both the back of the arm and back of the forearm, and also some muscles of the hand. Now, what happens if there is any lesion in the radial nerve? There is a condition called wrist drop. It's the common short note for your written examinations, also called radial nerve palsy. It happens when the radial nerve is injured, usually in the spiral groove, the posterior surface of upper part of the shaft of humerus. What happens then? If radial nerve is injured, all the muscles supplied by it will be paralyzed. What happens then? Radial nerve supplies muscles of the back of the forearm. Okay. So if the muscles of back of the forearm are paralyzed, then the wrist joint will not be extended. That is, muscles of back of the forearm act as extensor of the wrist joint, like this. So when the radial nerve is paralyzed, there will be wrist drop. The wrist joint will not extend, it will lie like this, dropped wrist. So wrist drop is the term used for this condition. This is wrist drop. This is a characteristic clinical sign of radial nerve injury, causing inability of contraction of the muscles of back of the forearm, causing a flexed wrist. Now the artery of the posterior compartment of the arm. It is the profunda brachii artery. It's a branch of the brachial artery, arises near its origin. It accompanies the radial nerve initially at the spiral groove, provides branches to the triceps muscle, and it also next takes part in formation of the anastomosis around the elbow joint. This is anastomosis around the elbow joint. It is an arterial network that is formed by some horizontal and vertical vessels around the elbow. This is profunda brachii artery. The arrow marks origin of the profunda brachii artery, shows it passing into the spiral groove. Now, what are its branches? Radial collateral or anterior descending artery and the middle collateral or posterior descending artery, they take part mainly in anastomosis around the elbow joint. There is another branch. This is ascending or deltoid branch, and it also gives a nutrient artery to the humerus. Nutrient artery, as you already know, it is one of the main blood supplies of a long bone. Long bone is supplied by epiphyseal arteries, metaphyseal arteries, periosteal vessels, and also the nutrient artery. So this is all for today. In our next class, we shall be learning regarding the contents, muscles, vessels, nerves, etc. of the back of the forearm and hand. Actually, I was not able to prepare this lecture in more detail as I was informed about this only a short time ago. This class was supposed to be taken by Dr. Noor Alam, but currently he is unavailable due to unavoidable circumstances. So this is all for today. Thank you for attending. Now, please, if you have any questions regarding the topic. জসিম সাহেব, ওরা কি মানে কথা বলতে পারবে? আমি শুনতে পাবো বললে? অন অন আছে না? So is there any queries regarding today's topic?
ম্যাডাম
পড়া হচ্ছে তোমাদের?
ম্যাডাম একটা কোশ্চেন আছে ম্যাডাম।
মনিটর আছে? কে ফোন দিছিল আমাকে? মনিটর আছো? আপার লিম্বের বোন কোনটা পড়া হচ্ছে?
No, ma'am.
না, এই যে কি কি সব চ্যাট দিতেছে, কি বলে কিছু নাকি বোঝা যায় না। কেউ কোশ্চেন করে একজন একজনের গুতাগুতি করতেছে, কিন্তু কেউ তো কোনো কোশ্চেনও করে না, কোনো মনিটরটাও পাইতেছি না।
ম্যাম,
হ্যাঁ,
আসসালামু আলাইকুম। কোনো বন্ধু হয় নাই ম্যাম, আপার লিম্বের কোনো বন্ধু হয় নাই।
কি কথা এগুলো বলেন তো? এই 104 এটা কে রে? মাথার উপর দিয়ে গেছে, সব বুঝলেই না প্রশ্ন করব? কি স্কুল কলেজে পড়ে আসো না? ইংরেজি বুঝো না? হ্যাঁ? Who the hell is this? 104 Sanjara. Who is this? মাথার উপর দিয়ে গেছে, সব মেডিকেলে ভর্তি হয়েছো কেন? ভালো মতো থেকে ভার্সিটিতে ভর্তি হয়ে যেতে, বাসা থেকে পড়াশোনা করতে, সুন্দর মতো পরীক্ষা ছাড়া বা পরীক্ষা দিয়ে একটা ডিগ্রি নিয়ে তারপরে গিয়ে সুন্দর মতো বিয়ে শাদী করে ফেলতা। মেডিকেলে কেন ভর্তি হয়েছো?